The COVID-19 pandemic has abated in much of the world and, with it, many of the social restrictions implemented to curb its spread, as people have been eager to return to pre-lockdown life. But in its place have emerged a series of viruses behaving in new and peculiar ways. Take seasonal influenza, more commonly known as the flu. Yet cases ticked up in February and climbed further into the spring and summer as COVID restrictions were stripped back. We've never seen a flu season in the U.S. extend into June, Dr. Scott Roberts, Associate Medical Director for Infection Prevention at the Yale School of Medicine, told CNBC Tuesday. COVID has clearly had a very big impact on that. Now that people have unmasked, places are opening up, we're re-seeing viruses behave in very odd ways that they weren't before, he said. And flu is just the beginning. Respiratory syncytial virus, a cold-like virus common during winter months, exhibited an uptick last summer, with cases surging among children in Europe, the U.S. and Japan. Then, in January this year, an outbreak of adenovirus 41, usually responsible for gastrointestinal illness, became the apparent cause of a mysterious and severe liver disease among young children. Elsewhere, Washington state has been experiencing its worst flare-up of tuberculosis in 20 years. And now, a recent outbreak of monkeypox, a rare viral infection typically found in Central and West Africa, is baffling health experts with over 1,000 confirmed and suspected cases emerging in 29 non-endemic countries. At least 2 genetically distinct monkeypox variants are now circulating in the U.S., likely stemming from 2 different spillover infections from animals to humans, the U.S. Centers for Disease Control and Prevention said last week. The World Health Organization noted earlier last week that the virus, whose symptoms include fever and skin lesions, may have been going undetected in society for months or possibly a couple of years. The 2 strains probably indicate this has been going on longer than we first thought. We are seeing very atypical behaviors in a number of ways for a number of viruses, he said. Restrictions reduce exposure. Immunity. One explanation, of course, is that COVID-induced restrictions and mask wearing over the past 2 years have given other infectious diseases little opportunity to spread in the ways they once did. Where viruses did manage to slip through, they were frequently missed as public health surveillance centered largely on the pandemic. That indeed was the case in Washington's tuberculosis outbreak, according to local health authorities, who said parallels between the 2 illnesses allowed TB cases to go undiagnosed. Now, as pandemic-induced restrictions have eased and usual habits resumed, viruses that were in retreat have found a fertile breeding ground in newly social and travel-hungry hosts. That could explain the uptick in curious severe acute hepatitis cases among children, according to health experts who are looking into possible links to COVID restrictions. We are also exploring whether increased susceptibility due to reduced exposure during the COVID-19 pandemic could be playing a role, the UK Health Security Agency said in April. The Centers for Disease Control and Prevention has also expressed concern that lockdowns may have caused many children to miss childhood vaccinations, potentially raising the risks of other vaccine-preventable illnesses such as measles and pertussis.